All right, let's dive right in. Today we're talking about something that happens all the time. You go in for a scan, maybe for your gallbladder or something totally unrelated, and the report comes back with a little note, incidental finding on the liver, a spot. So, what on earth does that mean? Yeah, that's a question that'll stop you in your tracks, right? It would make anyone's heart jump a little. You're suddenly staring at this medical unknown. But, the vast majority of the time, there's absolutely no need to panic. These spots are usually harmless, but you do need to know exactly what you're dealing with. So we're going to approach this like a medical mystery. Think of it like a detective story. We've got three main suspects for these benign liver lesions. Two of them are totally harmless, but one can be trouble. Your mission is to become the detective with me and learn the clues that tell them apart. Okay, let's open our first case file. This is the one we see more than any other. This is the hepatic hemangioma, and it is without a doubt the usual suspect. So what exactly is this thing? Well, it's actually pretty simple. A hepatic hemangioma is just a benign, harmless little tangle of blood vessels. The absolute best way to think about it is like a birthmark, just one that happens to be on the inside of your liver. It's not cancer, and it's probably been there your entire life. Let's look at the clues, the profile of this suspect. It is by far the most common. It's way more common in women, about a 5-to-1 ratio, especially between the ages of 30 and 50, and there seems to be some link to estrogen. But here's the most important clue of all. It almost never causes any symptoms. It's almost always found by complete accident. So how do radiologists know for sure? Well, on a CT scan, they use a special dye called contrast that makes blood vessels light up. And a hemangioma has this classic telltale look. It lights up on the edges first, and then that brightness slowly creeps in towards the middle. It's just like the iris of a camera closing. When they see that pattern, that iris diaphragm effect, the case is basically cracked. And the verdict for our first suspect? It's simple. We just leave it alone. We observe it. Surgery is incredibly rare. But, and this is a big one, here is the critical rule that cannot be broken. You never, ever biopsy a suspected hemangioma. It's a tangle of blood vessels, remember? Poking it with a needle could cause a massive bleed. So it's a hands-off diagnosis. All right, on to suspect number 2. This one can sometimes be a bit of an imposter, looking similar to other things. This is case file number 2, focal nodular hyperplasia, or just FNH for short. Now, FNH isn't a true tumor in the way we normally think about them. It's really more like the liver just got a little overenthusiastic. It's a reaction, an overgrowth of normal liver cells, probably because of a weird blood vessel nearby. I love this description. Think of it as an overachiever, not a villain. The profile here is going to sound kind of familiar. It's the second most common, and again, it's overwhelmingly found in young women. And just like our first suspect, it's usually asymptomatic, but here is a hugely reassuring piece of information. FNH does not turn into cancer. It has zero malignant potential. It's completely benign. And this one has its own dead giveaway on a scan. About half of the time, right in the middle of the lesion, there's a very distinct scar that looks like a star. This central stellate scar creates a pattern that looks just like the spokes of a wheel. When a radiologist sees that spoke wheel, boom, case closed. So the verdict for FNH, again, super straightforward. We just observe it. Maybe do a few follow-up ultrasounds over the first couple of years just to be sure it's stable. And just like before, we'd only think about surgery if it got so big it started causing problems, which, again, is really rare. Another harmless imposter, case closed. Okay, now, the tone of our investigation is about to shift. We've identified the 2 harmless ones, but our third case file is different. This is the one we have to watch very, very carefully, the hepatocellular adenoma. Now, unlike the others, this is a true tumor, and even though it's technically classified as benign, it doesn't always act that way. This one carries real, serious risks. It can rupture and bleed, sometimes catastrophically, and it has the potential to transform into cancer. This is our dangerous suspect. The profile here is very specific. It's rare, but dangerous. It almost exclusively affects women of childbearing age. And here it is, the big one, the clue that changes everything. There is a powerful link between these adenomas and taking oral contraceptives, birth control pills, or anabolic steroids. This scenario right here, this is a major red flag for doctors. A young woman on birth control who comes in with pain in the upper right part of her belly, that combination of factors immediately makes hepatocellular adenoma the prime suspect. You have to assume it's an adenoma until you can prove it's not. And the way we treat this is really interesting because it's completely different for women and for men. For women, the decision to surgically remove it often depends on its size, usually over 5 centimeters, or if it's causing pain. But for men, the protocol is way more aggressive. Because their risk of it turning into cancer is higher, the rule is to resect all of them, no matter how small. And this is exactly why the stakes are so high. An adenoma can just rupture out of the blue, causing a life-threatening internal bleed. And then there's that looming risk of it transforming into liver cancer. This is why it's the one to watch. So the protocol here has to be crystal clear and immediate. Step 1, and this is absolutely non-negotiable, stop the oral contraceptives. Right away. Sometimes, that alone can make the adenoma shrink. After that, it's a serious conversation about surgical removal or, if not, very close surveillance with regular scans. Okay, our investigation is wrapped up. Now it's time for the final lineup. Let's bring all 3 of our suspects together, side by side, to make sure we've got the key differences locked down. This table pretty much tells the whole story, doesn't it? We've got the super common and harmless hemangioma with its iris diaphragm clue. Then there's the also harmless FNH, the imposter with its telltale central scar. And finally, the rare but high-risk adenoma, which you've got to suspect with OCP use and pain. The threat level says it all. Harmless, harmless, and high risk. 2 we watch, 1 we act on. And that really is the crucial point of this whole thing. That little spot on a scan is overwhelmingly likely to be nothing to worry about. But likely isn't good enough in medicine. Knowing how to tell the harmless ones from the one that's high risk, well, that's absolutely key. So while a surprise finding on a scan can definitely be scary, being armed with knowledge is the best defense you can have. It turns that fear into understanding, and it empowers you to ask the right questions. Thanks for cracking the case with me.